TelePrEP is a collaboration between the Iowa Department of Public Health and the University of Iowa healthcare system that has a goal of making it easy to get PrEP everywhere in Iowa, including in rural areas, and in particular by overcoming barriers related to distance and stigma.
PrEP is pre-exposure prophylaxis for HIV. It is a medication that people who are vulnerable to acquiring HIV can take to prevent infection.
So we work really closely with all of our funded public health test sites across the state of Iowa and with our partner services program to make sure that we're doing our best on the public health end to identify patients who would benefit from a PrEP regimen, making sure that we're providing them adequate education and then linking them to this service in a really seamless way that makes entry into the healthcare system just as minimal and as accessible as possible for these individuals.
In Iowa, we also have HIV that exists in many of the rural counties, and people that live in rural Iowa tend not to be considered often when we're designing healthcare interventions and when people think about HIV prevention.
The first step in TelePrEP happens when someone in the public health setting chats with someone in a local community who can benefit from PrEP. The next step is that that person is connected to a telephone navigator who chats with the individual on a telephone and makes sure they have all the resources they need to begin the process of getting PrEP, ranging from healthcare insurance through referral to other resources that may be useful to that individual. The next step after that is for the person to obtain laboratory studies which are needed for PrEP, and that usually happens in a local public health setting. After that, the individual chats with pharmacists here at the University of Iowa using a telemedicine platform.
We do visits by video, so it's just like a FaceTime or Skype type video, and we do a lot of our conversations through email and text and by telephone, so really we do a lot virtually rather than in person.
So seeing somebody over telemedicine has been surprisingly awesome. Angie is really fantastic. The setup is super easy. There's never been any technical issues. It's always worked super fast.
One of our goals when we set out was to think about how can we demedicalize PrEP delivery in a rural state like Iowa. Why does it have to be that a person has to travel a long way from a rural community to a big healthcare institution and go through a lot of hassle to get PrEP? It should be possible for people to get PrEP easily, conveniently, in the community where they are.
As a result of TelePrEP, I'm seeing individuals from the public health sphere really access healthcare for the first time in a way that I've never seen them access it before.
I found out about the program through the Johnson County Health Department. I was getting tested for HIV, and then a person there introduced the TelePrEP program, and then kind of gave me more information, and it was something I had been wanting to do for a while. So I did not have access to PrEP before this program.
So I tried to talk to my family doctor about PrEP, and she was very willing to look into it, but I wasn't really getting anywhere. She didn't know for sure where to look. But when I contacted TelePrEP and started that process, it was super fast and easy, and I think I got on PrEP faster than I could have even started the process with my regular doctor.
So our goal for TelePrEP in the next few years is, first of all, to make sure that we're available everywhere in Iowa so that PrEP is easy to get for all people in Iowa. We also want to think about strategies for sustaining TelePrEP in the long run. We want to keep tinkering with TelePrEP and how we deliver TelePrEP, thinking about different ways to do this that make it more convenient for people to get PrEP where they are, in particular in rural settings. We also want to think about what can we learn about TelePrEP programs that can inform strategies for delivering PrEP in other rural settings.
So because this service really does provide the ability to access PrEP in a way that maintains your privacy and minimizes the time that you have to take out of your daily life, I'm seeing people who normally wouldn't have access PrEP because of those barriers of stigma, geography, distance that we've talked about, have an entryway into this system, and I think that's really fantastic.
My name's Daniel Lang. I live in Hiawatha, Iowa, and I've been on PrEP for about a year. And thanks to TelePrEP, I don't worry about HIV.
My name is Chris Jensen. I've been on PrEP for a year and a half. I live in Coralville, Iowa, and I no longer worry about HIV.